2020-2021 Severe Acute Respiratory Syndrome Coronavirus 2. The virus that causes coronavirus disease 2019 has many variants. Some are believed or have been believed to be of particular importance. This article discusses such notable variants of SARS CoV-2 and notable missense mutations found in these variants. The sequence WIV04, 2019. Belonging to the GISAIDS clade, Pango a lineage, next strain 19B clade, is thought to most closely reflect the sequence of the original virus infecting humans known as Sequence 0, and is widely used as a reference sequence. No consistent nomenclature has been established for SARS-CoV-2. Colloquially, including by governments and news organizations, concerning variants are often referred to by the country in which they were first identified. But as of January 2021, the World Health Organization is working on standard nomenclature for SARS-CoV-2 variants that does not reference a geographical location. While there are many thousands of variants of SARS-CoV-2, subtypes of the virus can be put into larger groupings such as lineages or clades. Three main, generally used nomenclatures have been proposed. Each national public health institute may also institute its own nomenclature system for the purposes of tracking specific variants. For example, Public Health England will designate each tracked variant by year, month and number in the format prefixing VUI or VOC for a variant under investigation or a variant of concern respectively. Viruses generally acquire mutations over time, giving rise to new variants. When a new variant appears to be growing in a population, it can be labeled as an emerging variant. Some of the potential consequences of emerging variants are the following. Variants that appear to meet one or more of these criteria may be labeled variants under investigation, or variants of interest, pending verification and validation of these properties. The primary characteristic of a variant of interest is that it shows evidence that demonstrates it is the cause of an increased proportion of cases or unique outbreak clusters. However, it must also have limited prevalence or expansion at national levels, or the classification would be elevated to a variant of concern. If there is clear evidence that prevention or intervention measures have substantially reduced effectiveness for a particular variant, that variant is termed a variant of high consequence. In early November 2020, Cluster 5, also referred to as Delta FVI spike by the Danish State Serum Institute, was discovered in northern Jutland, Denmark, and is believed to have been spread from minks to humans via mink farms. On 4 November 2020, it was announced that the mink population in Denmark would be culled to prevent the possible spread of this mutation and reduce the risk of new mutations happening. A lockdown and travel restrictions were introduced in 7 municipalities of northern Jutland to prevent the mutation from spreading, which could compromise national or international responses to the COVID-19 pandemic. By 5 November 2020, some 214 mink-related human cases had been detected. The World Health Organization has stated that Cluster 5 has a moderately decreased sensitivity to neutralizing antibodies. SSI warned that the mutation could reduce the effect of COVID-19 vaccines under development, although it was unlikely to render them useless. Following the lockdown and mass testing, SSI announced on 19 November 2020 that Cluster 5 in all probability had become extinct. As of 1 February 2021, authors to a peer-reviewed paper, all of whom were from the SSI, assessed that Cluster 5 was not in circulation in the human population. First detected in October 2020 during the COVID-19 pandemic in the United Kingdom from a sample taken the previous month in Kent. Lineage B1.1.7 was previously known as the first variant under investigation in December 2020. And early analyses suggest an increase in lethality. Variant of concern 202,102, O2. Described by Public Health England as B1.1.7 with E484K, is of the same lineage in the Rambo classification system but has an additional E484K mutation. As of 18 February 2021, there are 26 confirmed cases of VOC 202102, O2 in the UK. On 4 March 2021, scientists reported B1.1.7 with E484K mutations in the state of Oregon. In 13 test samples analyzed, one had this combination, which appeared to have arisen spontaneously and locally, rather than being imported, first sequenced in August 2020 in Nigeria. The implications for transmission and virulence are unclear, but it has been listed as an emerging variant by the U.S. Centers for Disease Control, sequenced by the African Center of Excellence for Genomics of Infectious Diseases in Nigeria. This variant has a P681H mutation, shared in common with UK's lineage B1.1.7. It shares no other mutations with lineage B1.1.7, and as of late December 2020 this variant accounts for around 1% of viral genomes sequenced in